hyperactivity and impulsivity component or subtype. So as we know, ADHD, way back in the day, used to be just ADHD, right? But now we have two or rather three subtypes. One is the impulsivity, or rather the inattentive, and then there's the hyperactive impulsive type. Most people will have the hyperactive type. Some will have the combined type, okay? So that, you know, it could be that in the morning they're more calm, but yet they're very distracted, where in the afternoon they're more hyperactive, or vice versa. Or it could be that they just sort of, you never know what you're going to get, right? All right, again, with hyperactivity, they're fidgety, they tap things, they're often moving, they squirm, they leave their seats in situations when remaining seated is expected. Parents sometimes refuse to take their children to places where they know they're going to have to sit for long periods of time. I'm not going to take them to church, or if I am, we're going to be in the back, or we're not going to go to a restaurant because I already know, you know, he's going to be all over the place. And so what ends up happening is the child never really learns how to behave in those environments. So the more that you avoid, the less that the child is able to learn that what's appropriate behavior in that environment. Okay, they often run and climb, you know, things that are inappropriate. Sometimes parents have to like bolt down their bookshelves, because this is a child that will climb it, you know, before you know it. What are you doing up there? You know, as young as 3, and that's why they're seeking help, because they're so stressed out. It takes so much energy to watch this child 24/7, okay? They're unable to play or take part in leisure activities. They lack the ability to sort of be creative and play. Sometimes it even looks like autism, where they'll line things up. They'll, you know, be doing things that are just, you know, completely inappropriate, and you're just like, why can't you just, you know, get your cars and play, like, you know, because they lack that ability to do that. They're always on the go. They have so much energy. I mean, they could have been running the whole day, and then come nighttime, they're still going, and they're like the Energizer Bunny, where their batteries, it never dies out. They're very talkative. They always want to be the one to be the center of attention, and they always have something to say, and if you're talking, they're going to interrupt you, because what they have to say is more important. Okay, it does get better as they get older, but it's still there, and we all have seen and met those individuals, right? And it's probably annoying to be around them sometimes, but you know, if they become aware and they work on it, and the more they understand and they practice those social skills, the easier it'll get for them. They often blurt out an answer before a question's even, you know, asked, and so the teacher's always having to redirect little Johnny, like, wait, you know, or even if their hand's up, she chooses not to answer or pick on him because she's already, you know, had him answer the last 3 times. They have trouble waiting their turn. And it goes back to that inability to self-regulate and the interruption. Okay, any questions about that? The following conditions must be met in order to have ADHD. Several inattentive or hyperactive impulsive symptoms must have been present before the age of 7. Okay, so if they come to you and he's 12 years old, and all of a sudden, well, he was well behaved, his grades were great, but now something's going on and he's not paying attention, he must have ADHD. Well, no, look at the history, ask mom, you know, was he, you know, having difficulties as a young child, following through on directions, do the whole history, and then you can have a better idea. Several symptoms are present in 2 or more settings. As we said, if you're going to screen for ADHD, don't just take mom's, you know, side, you know, see how they're behaving in the daycare center, at school, and then usually it's probably going to be, you know, everybody's seeing the same things. There's a clear evidence that the symptoms interfere with or reduce the quality of social, school, and work functioning. So obviously it affects every aspect of their life, really. The symptoms do not happen only during the course of schizophrenia or another psychotic disorder. So you probably want to rule out some of these other disorders that are probably more indicative of what's going on. If a person's really like having an episode, you probably want to treat for that. The symptoms are not better explained, again, by another mental health condition, like we were talking about, that anxiety and depression can also cause individuals to have ADHD-like symptoms. Okay. Comorbidity in children. These are, I think that they're listed in the order that they usually come in. Most of the time, 25% of the time, if you have ADHD, you're going to have a comorbid disorder, and it's usually going to be oppositional defiant disorder. As they get older into adolescence, it's going to turn into conduct disorder, and only 5% will turn into antisocial personality disorder, right? But they are more likely. There's a correlation between antisocial personality disorder, conduct disorders, and ADHD. And Dr. Beers can probably speak of that. Probably a large population of individuals in the jails are probably diagnosed with some kind of ADHD or disorder. Learning and communication disorders are also present. Anxiety. I think that anxiety usually comes because of the fact that this child really wants to behave, they really want to do well, but they seem to fail at it, and everybody's always getting on them, and so it just develops. They're kind of like kissing cousins. They come together, anxiety and ADHD, right? OCD also is very prevalent in kids with ADHD, depression, enuresis. It's not uncommon when we do a history that this child is having these problems, or encaprices, right? Drug abuse, very, very likely. Not everyone, as they, as they get older, it's kind of a way of self-medicating. If I smoke marijuana, I kind of feel better. I'm more mellow. People aren't on me as much. But I think it's 50% of the time they will use some kind of controlled substance. And as we know, if they're using marijuana, it's a gateway, and then they start using cocaine and some other of the harder drugs. So a lot of individuals with substance abuse problems are going to have ADHD also. Bipolar disorders, you're going to see a lot of sleep problems. Individuals, kids with Tourette's syndrome, tics, will also have ADHD. And then what we know as PDD, or pervasive developmental disorders. I think it used to be a diagnosis along with, Asperger's, and it no longer is. It's now all under the umbrella of autism, right? Many other forms of illness, such as asthma, can also, because of the lack of oxygen, can develop into ADHD symptoms. And then any accidental injuries, maybe falls, head injuries, things like that. All right, so I made a chart here of the comorbidity, and what you can see that 49% of the time when they have ADHD, they will also have depression, ODD, or conduct disorders, and anxiety, and they kind of overlap. Sometimes they'll have multiple, 2 or 3, okay? When I was doing psychological evaluations, it wasn't uncommon to have, like on the axis 1, to have ADHD, and then to have anxiety, and then to have, conduct disorder or whatever, because it is very common. Factors related to comorbidity, what causes it? Well, first of all, it's a very genetically transmitted diagnosis, okay? It's probably the most genetic diagnosis that there is out there, second only to depression and bipolar disorder. And not even second, I think it's so in other words, if mom and dad have it, it's very likely that the child will have it as well. If a sibling has it, then the other brother or sister will have it as well, okay? Which I found fascinating in the research, because I didn't realize it was that genetically linked. The greater severity of ADHD symptoms, the greater the severity of the ADHD, the more likely that it's going to be a genetic predisposition. Non-intact families of origin is also another factor. Individuals or children who come from maybe broken homes, as we know, there's not a lot of structure. You're probably going to see a lot more of the ADHD characteristics. Low parental income. Although ADHD doesn't have boundaries. It's seen in every country, even though maybe they label it different, maybe they treat it differently. It's everywhere. It's in China, it's in Russia, it's everywhere, okay? And it also, it's not necessarily income specific, but you're probably going to see it more with individuals that maybe don't have the resources to treat it early on, okay? Decreased parental interest and monitoring of the child is also another factor. And then affiliation of patient with deviant peers. So peer group helps exacerbate the symptoms, where maybe they don't have the role models that, okay, maybe I shouldn't behave this way because I'm not going to be accepted. Or maybe the other individuals around them act the same way. Parental ADHD, depression, antisocial personality disorders, and substance abuse are all factors that affect comorbidity. The developmental course, ADHD is persistent across lifespan in most cases. The severity, psychiatric comorbidity, and parental psychopathology predicts persistence. So if one of the parents had a psychiatric disorder, that's probably going to be a factor or predisposition for the child to also have ADHD or another disorder. Inattention remains stable, hyperactivity declines. So if they're inattentive, they're probably going to always be inattentive, okay? As we know, up to 75% of the time when a child is diagnosed with ADHD, it's going to follow them into adolescence and adulthood, okay? So the only thing that does reduce is the hyperactivity. Okay, the DSM-4, but now the DSM-5 may not capture adolescent adult manifestations of impulsivity. Adult outcomes, including psychiatric comorbidity, when ADHD co-occurs with conduct disorders, chronic criminality, and serious substances can result. So that's sort of like the perfect storm when you have ADHD and you have ODD and the parents like, what do I do? They're not just wiggly and jiggly that, you know, I can handle that, but they're so defiant, they're oppositional, they don't listen, I always tell them this is like the perfect storm. You know, you have a child with these multiple disorders and it's challenging, but it takes a team to treat the child. The psychiatrists, the teachers, the parents, the therapist, everybody working together over time, you can see the best results. And when ADHD does occur with depression, then they have a higher risk for suicide. You know, if I'm depressed and I have ADHD and I'm impulsive and I think about ending my life, then I'm most likely to do it, right? What is the prevalence? We know that it occurs in boys more than girls at a ratio of 3 to 1. And to adulthood, it evens out a little bit more, but it's still 2 to 1, okay? The rate is 6 to 10% of the population. It's more prevalent, like I said, in males than females. Why that happens, I don't know, but it is, you know. Females are more likely to be inattentive, and males are more likely to be hyperactive or have the combined type. 50% of children referred, again, to mental health clinics will have ADHD. What are some of the associated problems? Peer problems, you know, that's the people that are going to notice it first before the teachers and parents do. They're going to be like, there's something going on here, you know, he's always pushing, he's always doing this, and so they're going to have those problems. Inattentive symptoms, you know, are ignored. Hyperactive impulsive symptoms, actively rejected. Not deficient in social reasoning, understanding, but rather execution of appropriate social behaviors. Family dysfunction and parental issues are also associated. That's why it's so important to work with the parents and do parent training and teach them how to manage the behaviors, how maybe for them to be role models and you know, teach their children how to use impulse control and how to think things through and things like that. No clear causal relationship between family problems. In other words, you didn't cause ADHD because you were a bad parent or you caused it. That's always the one thing parents always feel guilty about. You know, what am I doing wrong? I'm not parenting this child well. Although the fact that, you know, you don't have the skills is going to make things more difficult, but just because you don't know how to parent your child doesn't mean that you caused it. Does that make sense? Okay, self-esteem issues are an associated problem, especially as they get older and they feel like, you know, why can't I meet timelines? Why can't I, you know, learn like the other people? Why can't I listen? And so they start to, it's like the self-fulfilling prophecy. They start to feel that I can't do it, and if they believe that, then obviously it comes true. The ADHD symptoms vary from setting. They probably do better in an environment that's fun, where things are exciting, it's immediate, high frequency. If things happen you know, early instead of they having to wait because they don't know how to wait. If they're being supervised, if there's structure, right? They do better if they're on one-to-one. If something is new and exciting. Interestingly, they do better with fathers than mothers. Okay, probably because they're bigger, or maybe because they're more, you know, black and white in terms of their behavior management, but they will do worse with mom, and they actually do better with strangers, believe it or not. You know, grandma takes the ADHD child and says, oh, he's an angel with me, he's so well behaved, but then you give him back to mom and he's just like, back to his old self. They do better in a clinical exam room, so where there's not a lot of distractions, okay? Where do they do worse? They do worse if it's boring. They do worse if the consequence is delayed or they have to wait. If the feedback is infrequent, if you have to wait till the end of the day to give them feedback about their behavior, they're probably not going to make the connection. Especially the younger they are, it's got to be immediate and consistent. Low salience, if it's late in the day, they're not going to do as well. They're probably going to learn better and do better in the mornings. So anything that's important for them to learn should be in the mornings. All of the other stuff should be in the afternoon. If they're unsupervised, they don't do well. They don't do well as well in group situations versus one-to-one. They don't do well if something is very familiar. It's probably going to be boring. Again, with mothers, they do worse, and then in waiting rooms, and we know that, we see that. In fact, a quick story. Here at Medical Center, we used to not have a children's room, so we just had our lobby. And so after a while, we started getting complaints from the neighbors where your children are running down the hall. And so we came up with this solution where we have a TV with these little plush, little chairs for kids to sit there. And so if it's an interesting movie that's going on, they will sit there and then their therapist will come get them. Otherwise, those kids are going to be running up and down the hallway and, all kinds of shenanigans. Okay? All right, talking about executive functioning, Russell Barkley is big on the fact, in all of his research that he's done, the fact that executive functioning is one of the main reasons why they're having problems with ADHD, that their executive functioning is lacking. Interestingly, the insurance companies do not pay for executive functioning evaluations. And we're like, well, that's the main reason why they're here. They're having problems regulating this aspect of their brain. So, but you got to work with what you have. All right, so what does that mean, executive function? They have difficulty self-regulating. So self-regulation means, the ability to think things through, to think of the consequences and all of that. They have limited self-awareness and self-monitoring. Like, you almost have to point out to them, are you even aware that you're doing this, or that when you say things it's kind of inappropriate? All right, poor use of hindsight and foresight and anticipating the future. Executive functioning also impairs the sense of time and time management. No idea, no clue. That for them, they can play a game for like 2 hours, and to them it was just like, well, that was just 5 minutes. No, you've been playing all afternoon. You got to put it up. No, just, 1 more minute. And so it's a constant thing. It's for them, it's not enough. Time just sort of just blows. All right, difficulties following rules and instructions and comprehending what you hear and read. So, their brain sort of doesn't process information very well. You have to repeat things or be very concrete in the way that you do deliver the message. Poor emotional control, like we talked about earlier. If they're angry, they're angry. If they're happy, they're happy. And they have difficulty motivating themselves. There's always got to be that carrot. So I always tell parents, okay, well, you got to, especially as they're younger, you got to be that carrot for them or present it to them. What is that week? Because it could change for next week. Maybe they're into dinosaur stickers this week, and next week, I'm done with the dinosaurs. I'm on to something else. So the parents always feel like they have to be a step ahead of them, and it's forever changing. Impaired problem solving and stimulating the possible future of what your options are, and this goes into adulthood. What are the outcomes of what you just said or what you did? People are not going to want to tolerate that. We do in children, but as you get older, that affects your relationships, your workplace environment, and so forth.